Hey guys, so we're going to talk about the immune system today, and I'm also going to throw in some other stuff that's not really in the textbook to talk about the counseling context. Okay, so this class, again, just as a reminder to kind of orient ourselves, this class is about the medical disabilities and the conditions that come with them. What we want to add to it is we want to add some sort of understanding of how we do this in the counseling context, and also because this is kind of a good place to talk about boundaries and barriers. That's what we're going to talk about a little bit today, too. We're just going to scratch the surface of that part, but we will touch on it just a little bit. So let's talk about the immune system here. First of all, the main purpose of the immune system is to protect the body against foreign substances. And there are kind of two parts of this. We'll talk about it next slide. We have the mechanical stuff. We have our skin, which keeps out bad stuff, right? If you get a cut, it can open up your body or your bloodstream more appropriately to foreign substances, right? Like not good stuff. Stuff can get in our nose and in our mouths, right? We're talking about in the time of COVID, everybody's covering their mouth to keep the bad stuff out, right? We also have these chemicals inside of us that go in and kill certain things, white blood cells. We have membranes around our eyes, and we have hair follicles in our nose to keep out bad stuff, right? So we'll talk about that a little bit. But the whole general purpose is to create a barrier between us and the outside world. That's the idea. When we talk about autoimmune conditions, we're talking about when these processes fail. And there's kind of two contexts where we're going to talk about these. One of them is that an overproductive autoimmune system can attack the body itself. In other words, it can misunderstand that, hey, this is an important cell and it's part of my body and it's healthy, but the immune system thinks it's bad and it'll attack our own cells in a way that it shouldn't. In the other context, it can miss foreign substances, and those can come in and invade us. Like a virus crawls into a host and floats by some T cell that's supposed to kill it, and the T cell doesn't, and so the virus lives and proliferates and that kind of thing. So there's kind of two contexts for this. A failing system or an overproductive system, something like that. An allergic reaction, we talk about allergic reactions, it's an overreaction to a foreign substance, okay? So a lot of this is just terminology, and I'm not going to get too deep into the science of it because I don't think that's necessarily what we need for the most part, but an allergic reaction is just a generic term, which is an overreaction to a foreign substance. For example, pollen comes into your nose in the springtime, and you breathe it in, and then the body says, oh my gosh, we need to freak out because pollen is bad, when it really isn't all that bad for us. It's not going to hurt us in this major kind of way. And then it says, okay, start crying, because crying is going to pour out all of the substances from your eyes, going to keep the eyes protected. And it's going to stuff up your nose because the nose says, oh my gosh, don't let anything in. It's going to clog and send all the people to the main gates. Some stupid analogy, but you get the idea, right? It's going to make you sneeze because it's pushing away all the bad stuff. So like that's what the body is supposed to do. Or it's supposed to protect, but it's doing it in an overreactive kind of way. There are some times when the immune system needs to be suppressed and sometimes when it needs to be boosted. Okay, so depending on whether it's overreacting or underreacting, that's going to depend on the condition, what the condition is called, and how it's going to be treated and all that kind of stuff. So just generically speaking, we can think about it in both of those contexts. When we're talking about the physical barriers, we talked about skin and membranes and hair follicles. There's also like the mucus that comes, that we have. We have this saliva stuff in our mouth that we can spit out to help keep bad stuff out. We have phlegm in our lungs. The hair follicles in our lungs create this mucus, and it keeps out foreign substances from getting deeper down into our lungs. It's part of why we cough, because then the foreign stuff can go up our esophagus, or up the trachea and down the esophagus into our stomach to kind of like kill it down in the stomach. We also have a very highly technical term. Our nose is filled with mucus too, and it keeps things out. That's why we have boogers. Boogers are the gross things that get stuck there, and we then sneeze, and we, if you're a child, just kidding. You pick your boogers to get rid of them. You blow your nose, all that kind of stuff. But that serves a very important function in our bodies. It keeps the bad stuff out. Okay. Also, earwax, another thing. Keeps things from getting clogged in there, and it eventually falls out and all that stuff. So you get the idea. There are also these antimicrobial substances, which are not just the tears in themselves, but they have this sort of antimicrobial. The tears actually kill the bad stuff. It's not like it's just there to flush it away, which it does, but it also kills the bad stuff. Same thing with saliva. I don't know if you guys all remember this, but when I was in, I don't know, 8th grade science class or something, we were talking about the digestive system. Saliva actually has agents in it that help break down the food, and then you're chewing on it, so you have this mechanical process and the chemical process, and it's already breaking things down, then it goes into your belly and breaks it down even more and does all that kind of stuff. But as part of that, it's let's find the good stuff and keep it, and get rid of the bad stuff. That's the whole part of the digestive system, and it's part of the immune system as well. Okay, inflammation is also a part of this. We've talked a lot about, throughout these different conditions, we've talked about things like decubitus ulcers, bed sores. They get red, they get puffy. It's just like when you get a sliver, or you have a hangnail, or a little cut on your arm or something. It's supposed to get red, it's supposed to get warm, it's supposed to get swollen. The whole purpose of that function of the body is to send something to that area to say, okay, here we go, let's fight anything that might come in. If there's a cut, we need to make sure that we're ready to attack any foreign substances that come in. If there's a break on the inside, we need to send stuff to cushion it and protect it, and that's what the inflammation process does. By the way, if you are accustomed to taking things like Advil or Tylenol or ibuprofen or whatever, those are medicines that reduce inflammation. That's the whole purpose of them. So if you have a headache, oftentimes that has to do with pressure in the head. And the part of it is a pain reliever, but also part of it is the anti-inflammatory, and that's to sort of suppress the immune system in times when it's reacting like it shouldn't. So it gets kind of complicated, but if you remember that sometimes it overreacts, sometimes it underreacts, this is kind of the territory that we're talking about here. There's this process called adaptive immunity. Okay, so this is kind of helpful to understand. And it has two parts to it. It has cellular immunity. In other words, you maybe have heard of this. The T cells that are there to fight viruses and bacteria and cancers, which, by the way, we'll talk about cancers next week. Cancers are just cells that are mutating and kind of deformed cells, something like that. And they're essentially not supposed to be there. They're doing things that are not helpful to the body. And some allergens. So this is, cells fighting cells, or cells protecting from other cells, that kind of thing. The thymus is a part of our body right around here in our chest cavity. And this is where this cellular immunity stuff takes place, or at least comes from. It doesn't produce antibodies. We'll talk about those in a second. But it doesn't produce antibodies, but it directly attacks the foreign substances. So in some cases, the next one down below, you have B cells, and this is called humoral immunity. These B cells, what they do is, instead of directly attacking another thing, like you have this fighter white blood cell and it goes and it attacks the bad thing and then it dies. It's kind of like a bee. Bees, when they sting something, they die sometimes. When bees sting something, it dies. It sort of fought the good fight, served its purpose, and now it's done. That's the same thing with white blood cells. By the way, if you've ever had an infected toe or an infected finger, all that pus, sorry, that's a gross word, some people don't like that, but that pus is just leftover white blood cells that have fought the good fight, and now they need to be discarded from the body. That's why you drain those things. B cells, on the other hand, they come from the bone marrow, not the thymus, and they move up to the lymph nodes, and they essentially sit there and they say, okay, wait till there's recognition of some bad thing or some sort of pathogen in the body, and then it produces an antigen, some other thing that then goes and takes care of the problem. So there's kind of different parts to how the immune system works, and different conditions respond to it differently. What we care about for our purposes is not so much that we understand all the science behind it, but that we can, as we get to know these various conditions, this is an intro, but we'll talk about the various conditions later. As we get to know those, we can say, is this an overreactive immune system or an underreactive one? And that'll help us understand a little bit about the condition of what kind of things do we need to watch out for. In other words, if we're helping somebody find work, or, let's take that one for a second. If we're helping somebody find work, do we need to be really careful about the kind of environment they're going into? Probably, right? Do we need to be careful about the energy expenditure and the fatigue and those kind of things that we talk about? Sometimes people might need to, even though they might look normal from the outside, being overworked and overstressed could be a really big problem. So those are the kind of considerations that you might take into account as we go through learning about some specific conditions. In the counseling sense, knowing the different condition and things like what the psychological response to the various conditions are, it's going to change a little bit. However, as we talked about in the very beginning, all these coping strategies are going to be fair game in all of this stuff. So in terms of understanding, is it an overreactive immune system? Is it underreactive? Partially, that really doesn't matter to us too much, depending on what our job task is. If we're going to be doing therapy with people, then we really care more about the coping strategies. If we're going to be going to help people with their work environments or understanding their careers and career decision making and that kind of thing, then it might be really helpful to know, or I should say it will be very helpful to know what the condition is and how it works, so that you can help somebody make good choices about what's going to be good for them in the future, something like that. Okay, just a few other pieces of terminology and kind of clarification here. When we talk about bacteria that cause disease, those are called pathogens, and those things can live independently in your body, as opposed to viruses, which invade a host cell and they need to survive. However, they can remain dormant in your body. One of the examples the book gives is if you had smallpox as a child, which I did, you have a dormant virus inside of your body right now that could produce shingles later, and shingles are this incredibly painful kind of sores that you get on you. So they kind of feel like a rash or look like a rash or something. But so I would have dormant virus cells inside my body that we don't really know what to do with. That is going to pop up someday and be really annoying. Okay, kind of a repeat here, but the purpose of the immune system is to recognize foreign substance. When the immune system attacks the body's own cells, not the foreign ones, this is known as an autoimmune condition. So in the very beginning, I said an autoimmune condition is when the immune system doesn't work. However, here they're giving a different description. It's a little bit confusing. But when we think of an autoimmune condition, we can think of it as either generically speaking, something that just doesn't work with the immune system, either overproductive or underproductive. But more specifically here, if you get asked this question, the best answer is that the body attacks its own cells. The body is attacking the thing it shouldn't be attacking in the first place. In other classes and other places, you might have heard me talk about this thing, the different types of trauma. And I'm not going to go into it too specifically right now, but there are multiple kinds of trauma. One of them is, we call it type A trauma. That's when bad stuff happens to you, things that shouldn't happen to you. Car accidents, sexual abuse, I don't know, bad military experiences, witnessing violence, all that kind of stuff. All the bad things that happen to you that shouldn't. That is trauma. When we talk about type B traumas, we're talking about things that are supposed to happen to you that don't. I wanted to be loved by my mother. I wanted to get picked for the baseball team. I should have opportunities to have access to things like education and fairness and equality and that kind of stuff. Those things are things that are supposed to happen, but they're not happening. And so trauma can come from essentially, sometimes we call them attachment injuries, times when I was supposed to be loved, but I wasn't. This is what happens when there's discrimination. It's kind of a type B trauma. I'm not supposed to be treated poorly by other people, but I am. Sorry, that was confusing. That would be an example of type A trauma. Type B trauma is because of racism, I don't have access to certain things, that kind of thing. So anyway, the reason that I tell you that is that I'm blanking on the reason I'm telling you that. When we talk about autoimmune conditions, we talk about overproductive or underproductive. It's very similar to these kinds of traumas. It's good things and bad things. When the body is doing something it's not supposed to versus when it is doing something it is supposed to, just not well enough. That's the idea. Hopefully that makes sense. Might have just confused you a little bit more, but no, whatever. Okay. Here are some examples of different autoimmune conditions: systemic lupus, erythematosus, and then rheumatoid arthritis. There are other ones. HIV is another one that will be covered by in a different chapter. One of the other things that I think is helpful to note too is when we think about things like organ transplants, uh, here's an example of a time when we need to trick the body on purpose. So we put a foreign organ from somebody else, part of a different immune system, a different body, different DNA, and we put it into somebody else's body. We have to purposefully trick the body into thinking, hey, this is supposed to be here. You don't want to reject this, right? And so one of the parts of the organ transplant process is to weaken the immune system so it doesn't work like it's supposed to, right? So this is one of those times when we say, like, we have to, kind of hurt the immune system instead of boost it up. So it can be helpful to understand that kind of thing, because somebody who's having an organ transplant has to be very, very, very careful about disease or bacteria or viruses or something like that. In the time of COVID, this is one of those things that I think is really difficult for us to wrap our heads around fully. We look at a person and we say, I don't really understand why you would want to suppress the immune system on purpose. Well, here's a really good example. Other people, if you've had cancer, part of what you get to do is you get to boost the immune system to kill all the bad stuff, right? But that means that you, because the immune system can be so tired and so weakened by chemotherapy and radiation, those people have to be very careful of viruses too, but for very different reasons. So it gets kind of complicated. There's a lot of science involved in it, and we don't often think about the science when it comes to how do we treat other people. But this is another one of those places where, from a counseling context, looking at somebody and having that, think Carl Rogers, think person-centered therapy, we say not unconditional positive regard, or another way of saying that is just a non-judgmental stance. When we're talking about that stuff, we have to assume, even before we know somebody, that their condition, whatever it means, whether it's an overproductive immune system or an underproductive immune system or whatever, we get to look at them and say, I don't fully understand it, and now you can tell me the details and we can understand those, but regardless of the condition that you might have, whether I see it or whether I don't, you're dealing with stuff, right? And so this is one of those things that clients often will get this, they'll understand it because they come in feeling judged. But this is part of that kind of like dealing with stigma in the rest of the world. How do we get the rest of the world to suspend judgment so that our clients don't feel the stigma because they're dealing with something that is frankly kind of confusing? And when it comes to psychological immunities, which we'll get to in a second, those are even more confusing for us to understand because we don't get it well enough. But when it comes to the science of this immune response kind of stuff, we are a little bit more willing to accept that. So anyway, let me just get to the last part. We'll skip on to the other stuff. So, well, we've already kind of mentioned this, that some cancers lead to immunodeficiency, and essentially it's an overworked system and we need to boost it. This is another example. Okay, let's talk briefly about, I think this is the last slide. Let's go back to the beginning and we'll do this. Let's talk briefly about boundaries. So boundaries are something that we hear a lot about in counseling, psychology, and this is one of those things that I think we're kind of now starting to understand what boundaries are and how important they are, but they haven't really been part of the conversation in this world of counseling and psychology for a long, long time. Okay, so if you're like, yeah, I've heard that word, but I don't really know exactly what it means, that's because nobody does. You know what I mean? So boundaries relate to this stuff because in the medical context, we talk about these barriers. A boundary is nothing more than a barrier. It just works a little different. In terms of barriers here, we have our skin and we have like keep the bad stuff out, keep the good stuff in, okay? In the counseling context, we talk about it in terms of boundaries, but it works a little bit different. So I'm going to go into this just a little bit. Boundaries are also a thing that keeps the bad stuff out and the good stuff in. However, there are plenty of times in our relationships and in our social lives that we are around the bad stuff, right? Other people who are crabby, we're like, ugh, your attitude just is so contagious. Keep it away, right? This is like a time when boundary is a barrier that we want to protect ourselves from the crabby people. However, the challenge for us is to, when we have interact with people who are acting poorly, we'll think of this in a different context. You have this person at work who's crabby, and you're like, ugh, I need to keep you away, right? So we have this fight or flight response as in response to the conflict that we experience at work, the crabby lady or the crabby guy, and we say, ugh, let's flight from this because we don't need it. That's one response. That's a completely legitimate coping strategy. Sometimes you can't do that, though. Imagine you have a child who's throwing a temper tantrum in a store. If we just flight from the situation, not so good, right? If we fight the situation, also not so helpful, leads to bad parenting or poor relationships at work with the crabby lady or crabby guy. Part of what we're trying to do, our psychological immune response, is to say, how do we fight or manage the negativity in the world? And the way that we do that, medically speaking, or biophysiologically, is we have these processes that kill the bad stuff and remove foreign substance. However, in a psychological sense, we talk about boundaries as a way to say, how can I maintain my integrity, my identity, a sense of who I am, and not have to compensate and change who I am and be the kind of person that I don't want to be because of the responses on the outside. So it's kind of like saying the boundary is a way to put up a wall that when bad things happen and try and invade us and our psyche, we stand firm, we know who we are, we know what we stand for, we have a good understanding of our values, and it doesn't change that, because oftentimes what we do is we compensate. If we have bad stuff happening on the outside and it kind of comes through our boundary wall and we say, fight or flight response, our brain starts firing and it says like, okay, we need to react to this. And it's not always angry. Sometimes it's just, I need to go tell you about who I am so that you know. But that's not really helpful all the time. Here's an example. When we talk about things like transference, countertransference in the counseling world, somebody comes in, if we don't have a good sense of our boundaries, a sense of who we are, what our values are, what's important to us, we might then react to this person in response to their requests for relationship. They might say, I actually like you so much and I think you're so wonderful. And we say, if I don't know who I am within myself and have good boundaries, I might compensate for my lack of boundaries or my misunderstandings of who I am and say, well, I really like being liked and you're filling a need for me that's not filled on the inside, so I'm going to change my behavior, loosen my boundaries, and then start to connect with you in ways that are not helpful. That's just an example of what that means. That's why in counseling programs, I think we don't do an excellent job just across the board counseling programs, psychology, social work, all the same stuff. We just generally don't do a very good job of saying, how do we understand our biases, we know about ethics, we know all that kind of stuff, but have we developed the kind of character that says, I have boundaries, not just I'm not giving out my phone number or telling you about private information, but I know my values, I know what I stand for. I know how to react emotionally. I can regulate when I have these experiences that would normally charge my fight or flight system and make me want to fight or flight or compensate for unmet needs, that kind of thing. So boundaries are, I'm just going to recap here again. When we are in a counseling education setting, or even as you go out into the world and you're doing this counseling stuff, when we think about the way our boundaries work, we don't necessarily attack and fight all the bad stuff, but we need to kind of maintain this sense of self, our own identity. That's how the psychological boundaries work. What's okay for you and what's not okay for you to do in my presence is part of learning about what my boundaries are, and how I respond to that is also part of that. Now, just to complicate this even just a little bit more, I know this is messy and confusing and I'm not being super clear on it because it's a little hard to do here in just, a quick, easy explanation. And I'm frankly not that good at it yet. I'm still kind of figuring this out myself. Part of learning what are my values, how do I regulate, emotional regulation so that I don't respond too much to invasions through the boundary wall. Part of learning that is learning about what am I responsible for and what are other people responsible for. And so an example of this is when somebody gets angry at me as the counselor because I'm not giving them what they're supposed to be getting. I'm a client and you're supposed to tell me how I'm supposed to live. You're supposed to fix the problem. And we're like, it's not really how that works. I help you process through to make good decisions for yourself, but I'm not going to tell you what to do, right? We sometimes have these reactions to other people, right? That's the countertransference stuff. If we don't have a good sense of this is my countertransference, this is my emotions, these are my decisions, and I'm responsible for those, then we can project back on our clients and say, how dare you would make me say something like that? Or I'm only reacting to you based on the way you're reacting to me. That reaction is not that helpful, right? Reacting to somebody in return, that countertransference stuff, is a misunderstanding of what I'm responsible for and what I need to take care of. So when it comes to understanding boundaries, and this is kind of the big takeaway point, I think, in terms of psychological boundaries, what we want to be thinking of is, do I know my values? Am I responsible for the decisions that I make and the emotions that I feel? And I'm not projecting onto somebody else and feeling like I'm the victim because they came in and brought their nasty attitudes and behaviors. Because if that's how you're thinking, it's not going to be helpful for you as a counselor, because you're going to say, these clients are just resistant. They are just, ugh, I don't like those kind of clients. It'd be kind of ideal if we could say, anybody who struggles could come through the door and I can at least not lose my sense of self. I can at least have good enough boundaries, know who I am, know what I'm responsible for, can own up to my own feelings and thoughts and that kind of stuff. If I can do that kind of stuff, I might not necessarily know how to treat them specifically, but at least I won't be afraid of them in a way that triggers my fight or flight response and then says, keep them away, or keep me away, or these are the bad people, or something like that. So I know this is really confusing, but it relates to this immune system stuff because it tells us a little bit about who we are, and is our fight or flight response system overworking or is it underworking? You know, are we letting people in a kind of a passive way come in too much and have too much influence over us, and we don't really protect ourselves well enough from that? Or are we too responsive and we want to fight against people? Our psychological defense mechanisms work very similar in that sense to the immune system. Sometimes it's a fight response, sometimes it's a flight response. Sometimes we're overproductive in our wanting to fix things and cure things. Sometimes we're underproductive, too assertive, too passive, something like that. So it's confusing, I know, but there's lots of good stuff to be learned about that, and we are still kind of trying to figure that piece out. But anyway, that's enough for me today. I will talk to y'all later. All right, see ya.